Hi, my name is Camille Aquillia, and I'm a student nurse from Queensborough Community College. The program is supposed to be 2.5 years, but you have a billion prerequisites, so now I've been at Queensborough for almost 4 years, but the program itself is really great. You come out with your RN after getting an associate's, and from there I could just move on to my bachelor's, and it's really good and really cheap. In general, with nursing, I feel like you really have to love what you're doing and really love caring about people. Otherwise, it's just people that are there for a paycheck. You can tell they're there for a paycheck, and that's how mistakes are caused. That's how people die. That's how people lose their jobs. And I feel like I have a genuine desire to help people and want to make them better. And not even want to make them better. I've always wanted to do something where I would have to interact with people because I feel like I'm making a difference. And I think if I did pediatrics or psych, I really have interactions with children and psychology itself, and I'd be able to make some kind of difference there, as opposed to if I had to do something very hands-on with ER or surgical. It's just a lot of blood and guts, which I totally love, but I would not be able to handle all the stressors. I'm thinking about going into pediatrics, but right now I'm not sure if I want to do pediatrics just because that's the only occasion where I'm older than all of my patients right now, or because I genuinely like being around kids. It's definitely hard to balance having a job. School first and foremost is just ridiculous, and nursing is only 9 credits, and I feel like it takes up my whole entire life because I have literally, I think, 500 pages of reading to do within 3 to 4 weeks while still maintaining my job. I work as a pharmacy technician, which does definitely help working with nursing. When I first started the nursing program, I made the poor mistake of working 2 jobs, and I was trying to have a social life, and I was trying to go to school, and that ended up definitely reflecting in my grades. So I had to ditch one of the jobs, and then I was still working about 21 hours at the pharmacy. I had to cut that completely. Now I'm down to 14 hours, and I'm only working 2 days a week. I pretty much spend all of my time in Starbucks. I read and drink a lot of pumpkin spice lattes. I like to pretend that I can go out on weekends, so I do sometimes, and it usually does not work out to my advantage because I have to be up at either 8, 9, or 10 every day of the week except Mondays. So I'm usually very tired. I always make the joke that nursing students cry every day because the clinical, when we're at the hospital, it's our clinical rotation, and some of the teachers are so stressful, and they'll like slap your hand if they think you're doing something wrong. Some of the teachers even curse at you. I mean, not to name any names. But this semester I got it easy. I finally think I found the right formula. Only work 14 hours a week, study, 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 never go out, sleep all the time, and don't piss off your clinical professor. And it's been working out pretty smoothly. Right now I'm dealing with a lot of geriatric patients on the medical surgical floor. So some of them are cute and some of them are really annoying. And the patients that don't speak are probably the hardest to deal with because it's not even that there's a language barrier, it's usually that they're a stroke victim or they're just in so much distress that they can't say anything. Recently I came across 2 ladies with dementia, and they would go in and out of it, and they were really sweet, and the doctor kept coming in and out, and he was like, you have to keep orienting them to time and place. So I kept telling the lady, I was like, you're at Winthrop University Hospital, and we were trying to get them to say the word hospital, and they both couldn't say the word hospital. So the doctor goes, okay, I'm gonna come back here in a minute. If you guys don't get it right, one of you isn't getting Wendy's, just lying or whatever. So he comes back in, and we're both trying to tell them, okay, what are we? We're nurses, right? Where are you? And she's like, oh, it's on the tip of my tongue. And she finally said Winthrop University Hospital, not even the word hospital. And as we were watching TV, she kept pointing at Rachel Ray and saying that she is a beautiful mother and that her mother is the loveliest person we've ever met. And then she went to the other lady in the room and she's like, "Are you Rachel Ray's mother?" I'm like, "No, she's not Rachel Ray's mother." And then the poor lady with dementia as well, she was just like, "Oh, no," she was like, "I don't even have kids." So they were hot messes, but they're really cute. I love dealing with patients like that because I feel like even though they don't really understand what's going on, they at least appreciate whatever you do have to offer.